thank you for joining us for what is my third Facebook Live event, but I know we've had several. We've had one hosted by Rachel Cole, our VP of Engagement, and one hosted by Renee Powell, who is our VP of Wellness. And so appreciate you always tuning in. Today's piece hopefully will be not too long, so I know everyone's time is valuable, but I want to start like I start every call, and I think I'm very blessed to say this. We currently don't have any COVID-19 cases across any of our Vitality communities with team members or residents. And as we're all watching the news and going through all of this, that's a quite, it's a blessing to be able to say that each and every day. And I could not say that if without the hard work that all our teams across Texas, Tennessee, Alabama, and Florida are doing every day to limit the exposure of themselves and our residents to the COVID-19 virus. I just really want to thank all of those team members and what they've been able to do and what they've been able to accomplish. They're still doing the Facebook Live updates, so if you can jump into those daily and get an update to see into the life of the buildings, I think those are always great and very helpful. But they're getting on calls with us every day, giving us updates, managing changes in protocols and procedures. As we look back over the last several weeks, we've had to change sometimes by the day depending on what we're learning and what's going on. And the teams have just been so miraculous in just their ability to change, move, and update and try and put on different pieces and different practices in place to try to keep our residents and themselves safe. And they're still managing the business day to day. They're still making sure that our residents are getting 3 great meals a day. They're still making sure our residents have what they need from a standpoint of medications and care. And people are living. Life has not stopped. Life has not been canceled in Vitality Living. And that's due to the incredible people we have working across our communities. They're just so amazing. The stories are endless. And so I thank them. I also want to thank all of you, our families. Without your support, this would be even more difficult. We know how hard the choice of not being able to see your loved one is, not being able to come in and visit is. I've talked to several families over the last couple of weeks and had very personal conversations with them. And it's hard, and my heart breaks that I can't let you or your loved ones see your loved ones. I know everyone's trying, and they're calling, and they're doing video call, but it's not the same as being able to look across and really visit with someone and give them a hug and put your arm around them. And to me, that's personally probably the saddest thing about all of this. But then I say with true conviction that if we didn't fully believe that the steps we're taking would help limit the exposure to our residents of the virus, then we would be taking them. And so we're following the mandates that we've been given by our local government and federal officials, and we're making sure we're just doing the steps. And I know these steps are hard, and I know they're difficult to get through, and I just want you to hear from me. We don't like them any more than you do, and I promise you, when we feel like we can safely lift these restrictions, when we feel like we can lift restrictions and keep our residents and our teams safe, we will do it. We want to make sure we keep our people safe, and we're going to make decisions based on the information we have. But we just thank you for supporting us, and the support from families has been overwhelmingly fantastic. So thank you. In addition, we continue. My last call, we talked about several actions that we are taking, that we continue to have in place, from screening of our employees when they come in. They're taking a questionnaire, their temperatures are being taken, they're asked to wash their hands. So we're still doing all those pieces where we limited visitations to only essential caregivers. We're not letting even vendors in. We're not letting people that aren't essential into the building. We're taking as little from the outside as we can. And again, our goal is to limit the exposure. In addition, we're doing some things in addition to that too. We've added some things over the last week. We have started having our caregivers in direct contact with residents wearing masks and gloves during direct care. We think this is just a smart next step to take. So if you see a mask in a picture, please, I know the masks can be scary, but understand we've put that extra precaution in place solely as a precautionary level, just to limit the spread of anything, a cough, a sneeze, anything. Not just coronavirus, but the common cold, the flu, and all those pieces. We know a trip to the hospital has got a little bit more, there's a little more behind a trip to the hospital now for a resident. So we're taking that extra measure. We felt it was good. We continue to perform additional cleaning above and beyond the normal cleanings. We're working with different cleaning partners to also source better chemicals and things that we know can really properly clean areas and kill the virus. So we continue to do that. We continue to work with partners to source additional and extra PPE as we prepare for if we do have a positive. If we do or when we do have a positive, we'll have the right PPE procedures and equipment in place so that we can protect residents, protect our caregivers. We're working on our communication protocols so we can make sure we're transparent and we're effectively communicating to everyone, residents, families, team members who would possibly be involved with this or infected. And then we're working on our protocols. How are we going to isolate? How are we going to manage? For us, it's really about trying to limit exposure and then detection. That's why we're taking temps multiple times a day for residents. That's why we're asking the questionnaires every day for an employee. Even if an employee's been only gone a few hours, they're taking that questionnaire again so that we can detect if we do have a situation, detect it early, and act accordingly. I think the additional thing that we added that's very, very exciting is we are working with a lab called Integrity Labs out of Knoxville, Tennessee. They're a partner of ours that we've met through a mutual connection. They have been supplying us with COVID-19 tests, and they are able to, when it mandates, and we are following the CDC guidelines, and when appropriate, we have the ability to test residents, new residents, and team members for the virus and get results back in a relatively short period of time. We're getting results back within 24 to 48 hours. And so we've tested it, the process works, the lab's been a fantastic partner, and again, we have to follow CDC guidelines and have doctor's orders. So this is not something we can just go out and test everybody, but when the situation warrants it, and we have a doctor's orders and it's within the CDC guidelines, we do have the ability to test. And we think this is just, again, another added layer of awareness and hopefully detection and protection. And so we think this is a really great add-on to what we already had in place. And so everything we're doing is centered around let's limit the exposure and hopefully prevent the exposure of the coronavirus to our residents and our team members. And again, I thank all the team members for how hard they're working. This has added a whole new layer of responsibility and accountability to them, and they're managing it fantastically. The other piece I would say is we still continue to live. Life has not been canceled in our communities. And so I mentioned earlier, we're still doing the Facebook Live events. Those are happening daily, so please search and reach into those. We encourage you to reach out to your executive director and your engagement directors if you want to set up a video chat with your family member. They'll help you do that. I've watched and talked to many families that the video chat, yes, it's not the same as being in person, but it sure as heck does give that connection. It gives you something, and that's better than not at all. And I think it'd help ease your mind just to being able to talk to your loved one. So reach out to our executive directors and our engagement directors and let them set that up. We also really want to focus on what's going on and trying to communicate as much as we can. And so our teams have been posting a lot more. And so a little bit on the difference, I've spent the last 2 Facebook calls, I've been the one talking the whole time. But I think one of the things that recently our team in Traditions at Smyrna in Smyrna, Tennessee, and I'm going to share this video in a minute. We're going to try something new and try to share it, but really sent out the message that life has not been canceled, right? We're still finding times to sing with our residents, dance with our residents, laugh with our residents, and just life has not been canceled in the communities. And so I want all of you to know we're doing everything we can to keep your loved ones safe, keep our team members informed, keep you informed. I know everyone has a lot of questions, and I wish we could answer them all, but we're learning, and we're every day changing and trying to adapt to what is an unknown. And so I leave you with the one thing ultimately, regardless of coronavirus, regardless of everything else going on, we still have residents who live in our communities each and every day. That's their home. And so I want to just assure you, life has not been canceled at Vitality Living Communities. And so I'm very proud of the team at Smyrna, and I'm excited to share this video with you. I hope you enjoyed as much as I did.